going to be a stimulus bill. You know what that means? We're gonna pay for people who are being financially burdened by this, and there's a lot of people who are going to face a financial hardship. We all acknowledge it. We understand it. For me, it's a question of who pays for it. I wonder why China isn't taking any responsibility for introducing this virus into the world. Certainly didn't do it intentionally, I don't think. There are some theories about where this virus came from, how it mutated, how it got here, how it spread to Australia and Japan and all over the world. But under the guise of never missing a crisis with an opportunity to do something you wouldn't ordinarily do, there have been multiple senior White House officials who have told reporters that House Speaker Nancy Pelosi actually sought to include a way to guarantee federal funding for abortion into the coronavirus economic stimulus plan. The officials said that while negotiating the stimulus with U.S. Treasury Secretary Steve Mnuchin, Pelosi attempted to lobby for several provisions. One was a mandate for up to $1 billion to reimburse laboratory claims, which White House officials say would set a precedent of health spending without the protections that are outlined in the Hyde Amendment. The Hyde Amendment blocks clinics that perform abortions from receiving any federal funding. Democrats have tried to push the Trump administration to end that since the day he was elected. So this is a way for the Democrats to try to get federal funding for abortion again. Wow. Now, you tell me what coronavirus funding has to do with federal taxpayers footing the bill for abortion. Let me give you some good news in the middle of a lot of bad news. And man, there's a lot of shaky, unnerving things happening. I've got lots of friends in New York. I'm staying put in Florida, not going near New York right now. The streets are empty. The supermarkets look like war zones. There's just a lot of concern about, and of course the concern stems from the fact that we're not testing thousands and thousands and thousands of people a day like other countries are. And this has been a problem. Fauci said it yesterday. I'll play the clip for you. It's hard to get these coronavirus tests into the hands of the people who need them. I had a friend yesterday in the New York area who went to her doctor and was told she didn't have enough of the criteria to get a coronavirus test. And she's afraid that she was exposed to somebody who has the coronavirus. And the doctors are very reluctant to refer somebody to get a test. Here's a text message on the MyPillow text line. I'm getting a lot of information, a lot of pictures being sent at 1-800-655-6453, which we appreciate very much. Please never text and drive. Hi, Mike. My daughter-in-law went to urgent care yesterday with flu-like symptoms, body aches, stuffy nose, and a fever. And they told her her fever wasn't high enough to be tested for COVID-19. I haven't heard this before. Well, I'm hearing it a lot. I'm hearing that doctors are not willing to refer patients for coronavirus testing, and it has to be that they don't have enough tests. It doesn't have anything to do with the criteria. It has nothing to do with the criteria, a checklist of how high your fever is. Dr. Tony Fauci, who is respected on both sides of the aisle, testified yesterday that we definitely have failed in getting enough coronavirus tests ready ahead of this storm, of this gathering storm. Here's cut number 7. This is audio and video from Fox News. Here's Dr. Fauci on these coronavirus tests.
Well, you know, the system that was built, that the CDC, when they made their test, is more for a public health type of response where they give this test to the state and local public health groups. When a person comes into an office with a doctor, they order a test. That system worked very well for other situations. When you have something where you need a much broader display of tests throughout the country, you have to have a different system. And the different system is a system that involves the public sector and private individuals to get involved, where everybody steps to the plate. So what we're doing right now is getting the private sector involved, the companies that make a living doing these tests, getting them involved and looking forward. You're right. Going back, the situation was not optimal. It didn't function the way we'd like it to have functioned. But going forward right now, with the private sector involved, you're going to see a major escalation of capability of getting people tested when they want it.
See, this is America. This is what we do. Private sector solutions, working with the government when needed, like now. And it's already happening. U.S. health regulators have already approved a new coronavirus test that will speed up by tenfold the ability to test patients. This has to do with the company is Roche Holding. They have a 6800, 8800 system. The 8800 system is capable of testing 4,128 patients a day. The 6800 version can test as many as 1,440 a day. So that's what has to be done. We have to be able to test people. And let's also remember perspective. The vast majority of people who contract coronavirus are going to be fine. My gosh, I saw a number last night. I think it was 60 of 60,000 people infected in China, 40,000 of them did just fine. No, excuse me, it's 80,000 infected, 60,000 were fine without even any major symptoms. So there is not a reason to run to the streets panicking and screaming with your hair on fire. You just have to be smart. And we ought to take precautions. Some of the precautions right now seem ridiculous to me. I had a friend who belongs to one of these medical groups. Here's the medical group email that just went out from this friend of mine. It's not my doctor, but it's somebody else's. And she pays a lot of money to belong to this medical group. Please know that your physicians and nurses are here for you should you need them. We're open and caring for our patients both by phone and in the office. To help control the spread of COVID-19 and provide care to those who need it, we are postponing all annual physicals and moving follow-up and wellness visits to phone calls until further notice. Our offices will remain. Now, I'm reading this, I'm thinking, isn't now the time you want a wellness visit? Maybe there's a 73-year-old patient who thinks I have pretty good time to get a physical. Our offices will remain open as scheduled for sick care and medications that must be administered by a health professional, but we're trying to limit anyone's exposure to potential contagion. So again, there's so much fear, there's so much hysteria, and yet, how much will the media report on, oh, I don't know, this story that's pretty good news. Apple has reopened all of its stores in China. The tech giant's 42 branded stores across mainland China are open for business today. Of course, Apple had shuttered its Chinese stores in early February. So the coronavirus outbreak is waning in China. Believe me, it's going to be waning here too. But we're going to go through a cycle. Now that we're introducing more coronavirus testing, and there are people who are being turned away. There are people who have reasons. I've been reading about people at Mar-a-Lago and CPAC and all these different events. The JetBlue plane last night, a sick guy got on the plane, and when it landed, he found out he had tested positive. He got a text message or a phone call. So, of course, everybody freaked out on the plane. So people are going to want to get tested. You should be able to go in at any point, at any time, and get tested. Because then you'll know. If you test positive, you go immediately home, you self-quarantine. If you show symptoms, of course, you reach out to your healthcare provider. That's what we know has to happen. Denver has finally done something that they've been doing in South Korea for some time. They have a drive-through corona test facility, a coronavirus test facility. So if you think you might have come in contact with somebody, it is a long wait, apparently. Just got a text message from somebody in the Denver area, 4 hours. But hey, if you're afraid and you're concerned and you're anxious and you think you may have come in contact, you probably would want to sit in the line for 4 hours and get tested. Or I don't know if it's a line is 4 hours or if the results. I know somebody who got tested yesterday in New York City, and he was told it would take 2 to 3 days to get the test results back. And of course, you wonder, why is this person tested? Well, I don't know. I guess it depends on who you know. This person is backed by a big company, happens to be a performer in a Broadway show. So I guess a Broadway actor gets a test where maybe a mail carrier or an insurance salesman or a car salesman won't get tested. And I will admit, and incidentally, none of this is President Trump's fault. The Trump administration is doing everything it can to get ahead of this thing. Michael Goodwin wrote a great piece. He watches these things very closely, the Pulitzer Prize winning writer of the New York Post. Trump has handled this perfectly, he said. He's passed the coronavirus test with flying colors. His speech, contrary to what others are saying, big, bold, optimistic, and compassionate. With fear and panic spreading across the land, Goodwin writes, threatening to take down the economy, President Trump is facing the greatest test of his presidency. Although battle-hardened by brutal fights with Democrats, the biased media, and foreign adversaries, he's presented with problems of a different magnitude with the coronavirus. It's a global menace that has declared war on America. Truth be told, sometimes in recent weeks, the president has appeared to be a reluctant commander-in-chief. Thankfully, as of Wednesday night's speech, that reluctance is history, replaced by a president who left no doubt that he is all in on the battle against this deadly scourge. Now, incidentally, here's another cancellation. Just came over the wire. They're canceling the Masters tournament at Augusta National. Just got that bulletin in. I'll give you the details, but for some people going to the Masters, man, what a memory I have of my late father-in-law who snagged 2 passes to the Masters. It's 2 of the hardest tickets to get in all of sports. He had them for many, many years, took me many times. John Dujardin got to go, and I think Field and Culbreth, I think some other friends of ours went, Trevor and Matthew. They have canceled the Masters at Augusta National. But let's get back to the president's performance in all this so far. The other night, he made a couple of apparently stumbles where he didn't specify on the Europe travel ban about European citizens or rather American citizens. Guess what? This guy has run the country for 3 years. Prior to that, he wasn't even a city commissioner anywhere. He's been, you talk about on-the-job training, that's Donald Trump.